Hello there, viewers. This is Rochelle Insurance Girl, just for the health of it, and I have a special guest today, Dr. Brett Berner. Welcome.
Hey,
welcome to our headquarters here in Clearwater.
Wonderful.
And as you guys know, I'm coming to you as your health advocate. It's always my goal to bring you some really good information on the health industry. Really want to empower and educate you on that healthcare spending, making sure you know about the latest, the greatest, and that you're spending those healthcare dollars wisely. So today I'm super excited to introduce Dr. Brett Berner of Foundation Chiropractic. Dr. Berner is opening his practice, is it later in October?
Yeah, it'll be at the end of October.
Being
pushed back due to permitting with everything going on, but I am really looking forward to getting everyone healthier and getting everyone back on track to experiencing the true meaning of life, quality of life improvement, and really just enjoying themselves to their full potential.
I love it. I love your energy, and I love just the idea of your practice, and we're going to hear a little bit more about that in just a moment. But Doctor, tell me a little bit about your background.
Sure. Yeah, so I grew up in Palm Harbor, went to Palm Harbor High School, and I went to Florida State University, which was great, Seminoles, even though they're not doing too well. And then my college was at my chiropractic school was in Palmer, Florida, in Daytona.
Okay.
But what really got me into chiropractic was I was shadowing different doctors, and I discovered that chiropractors have different techniques. There's some of them that do things differently, and I figured out it's because the human body is so complex. There's so many different ways to go about it to try to fix it or to get back on the track to get healthier. So I shadowed this one doctor that just focused on the upper spine at the very top of the neck, and she was seeing about 80 patients a day, which was just phenomenal. Just nonstop, helping out a lot of people. And I would talk to her patients, and I would ask them, like, okay, what's going on here? Because I'd never seen this before. She takes this instrument, and it's like a gentle percussion right behind the earlobe, and it would fix a lot of these issues. So I came home from Christmas break back when I was at FSU. My dad, he served time in the military, so he wrecked his low back being on those big planes, and I saw him using a cane to walk around. His low back pain was so severe, and it just broke my heart.
It hurts to see those that you love in pain like that.
At 50 years old, I mean, almost anyone, like, we don't need to get to that point in our lives where we're using a cane or a walker to, to try to move. But at that young of an age, I was like, Dad, what's going on? Well, they want to do surgery, they want to put me in a wheelchair, and they want to give me medication, and that is the mainstream form of treatment, which, hey, for some people, if they want to go down that road, that's what they have the choice for. But I told them, I just shadowed this interesting chiropractor, to say the least, not knowing too much about it, and I'm like, you need to go see her, have the consultation, figure out what's going on. So she does the x-rays, she figures out his low back. There is some decrease of the joint space, but at the top of his spine, even though he didn't have neck pain or headaches or anything like that, his first neck bone was so rotated, it was causing severe muscle spasms and pain traveling down to his low back.
That chain reaction.
Exactly. So like if someone has a heart attack, sometimes they get the chest pain. What's the first thing? The left arm numbness, the shoulder pain, the pain like that. It's not directly correlated to the heart. So he goes in there, he comes back the next time to get the first correction done. She lays him on his side, his head rests on a headpiece, and the instrument is just a very gentle tapping device. It's 100 times faster than a muscle reaction. So if you can't, twitch and move it, it's that
That
quick.
is new. Yeah.
Definitely. And about a pound or two of force. So that's all it takes, because at the top of the spine is that little tiny atlas bone. It's only 2 to 3 ounces, but the head's like a bowling ball, which means we got a bowling ball on a pack of gum, basically. The pack of gum is always moving and shifting, and we get compensations from that because the head is off-centered, so the body has to compensate from that. We get low back pain.
I love that analogy. You're such a great educator. Doesn't that just help make sense? Help paint the picture?
It's easy to give these types of metaphors to someone, because it's simple. We all get our tires aligned, right? You can just take it to the shop to have them move and crack and move things around, or do they put it up on a lift and they use a software to figure out how the tires and the axle of the car is misaligned, and then they correct it back to normal. So why can't we do that to our spines? Okay, so she did a correction. My dad stood up, and he never used the cane ever again.
Wow.
So from the first correction, we're fixing what I call the primary condition, the foundational shift. a shift in the body's foundation. So just like the St. Louis arch, okay? Really thick base, tiny skinny at the very middle, okay? What's the most important block on that?
Yeah, definitely the foundation, right?
Exactly.
You gave me the answer.
It's okay. So if we take away those larger ones,
Yeah.
it's still going to be there. We take away that smallest block at the middle of that arch, the whole thing falls apart. And that's how important, one of the smallest bones in the spine is that atlas bone, and it's just how we're made. But that's how we're able to roll our head around in circles. 70% of the head range of motion is done at that upper spine. So it shifts a lot of the time, and it causes these compensations. Sciatica, leg pain, low back pain. I see a lot of patients with low back pain, and I'm not doing the traditional chiropractic manipulation. Of course, I'm not putting them down. A lot of people get a lot of benefit from their chiropractor, but at the end of the day, they're getting the temporary increase in range of motion, temporary decrease in pain, because they're patching drywall in the house with a weak foundation. Okay, so why is the low back keep coming back? Why is the pain in your knee keep coming back? Probably because the primary condition, the upper spine is shifted, causing you to be off balance, and you're putting more weight on that one side, on that left knee or on the right knee, causing that kind of pain.
That makes great
so
sense.
Once my dad told me about that, he came home and I'm like, so where's the cane? He said he threw it out.
Wow, that's a beautiful
So I was
thing.
like, you know what? That's it. That's what I want to do. So I got into chiropractic school, learned this technique, traveled around the country to get this certification done, and it's been great helping out everyone the past 6 years.
That's amazing. Yeah. So where is your practice going to be again?
Yeah, so Foundation Chiropractic is located in Lutz off of 54 in the Suncoast Expressway Parkway.
You know, that is really an underserved area as far as chiropractic goes.
There's a lot of people that just keep moving down to Florida, and that is one of the largest or fastest growing towns, neighborhoods in all of Tampa. That whole 54 is going to turn into US 19, and that to me is just people that need to get fixed, or really to check to see if they need to get the correction. They need to get healthier. A lot of young families, even little kids too, because kids still have spines. And what do kids do a lot? They like to roughhouse and play on the playground. And they're not going to complain too much, even though I'm getting more about headaches and neck pain. I did the Great American Teach-In last year, back when everything was fine, and I asked them to raise their hand. The first question was, how many of you in here get headaches? 90%.
Wow.
90%.
Wow. Isn't that startling? Isn't that just alarming?
First graders.
Wow, that's
so
amazing.
does it make sense, no matter what the age is, even a 7-year-old, should they be getting headaches? And then people say, oh, I'm having my normal headache, I'm going to take a Tylenol, which, hey, it's your choice, it's 20 cents, you can get a temporary relief, but it's a normal headache. No, it's not. Having a normal headache is like saying you're having a normal tumor. You shouldn't be having them. No, it's abnormal. And if we can fix the cause, especially at a younger age, with this technique, it's very gentle. There's no cracking, popping, or twisting of that neck. I've seen newborns, because the birthing process is very traumatic, especially a C-section.
Sure.
And that's just how we do things, but they're going to pull on that little baby's head, the newborn's head.
So no cracking, popping, what was?
No, because these bones, especially the newborn, not a lot of bone is formed, it's a lot of cartilage, but that atlas bone is formed. And when they're pulling on that head to pull them out of mommy, they're not going to say, ouch, my neck hurts. What does the baby do? Screams, colicky. So when parents have a newborn that is just colicky, it's always screaming and crying, it's telling you my neck hurts, my back hurts, I just experienced a lot of trauma right when I was born, can you help me out? So most of the time, kids are sometimes my best patients, because they understand, this helps me, this is good for me, I will listen. Usually it takes around 3 to 4 adjustments, but I've had smaller toddlers crawl up on the table and just lay flat and not move, because they understand, I'm here to get corrected, I'm here to not just feel better, but to function better. And if we can get them functioning at an early age, it sets their body up for success. It sets them up from not having to deal with scoliosis. Because if you got scoliosis and you did not get x-rays after the age of 20, it's already formed and it gets worse and worse.
Yeah, it doesn't get better, does it? That's so fascinating, because a lot of times when we talk about chiropractic, we're thinking about people with back pain, and certainly, this type of innovation is changing the back pain industry. My viewers know that I do a lot of research on the back pain industry, and you and I both know that those back surgeries, we want to do anything we can to avoid going under the knife. So often you come out in worse shape than you started, unfortunately. But tell us a little bit more about how you're helping people with wellness and other areas with your practice.
So it's really simple. Our bodies are just incredibly powerful. You fall down, you scrape your elbow. What happens? If it's not really too bad, a scab forms. A couple weeks later, scab falls off. You look down at your elbow, and it's gone. Like, you don't see that scab anymore. It's healed. The body is a self-healing, super machine.
Yeah, heal myself.
If given the right foundation, it can heal itself from certain things like that. And it can range from dealing with headaches, even blood pressure. There was research done in Chicago University back in 2007. They noticed that if the upper spine is shifted, what's going to happen? It's going to obstruct some of the blood flow to and from the brain, back to the heart. So what does the body do? It has to balance out that slight blockage of blood. So blood pressure, systolic, the top number increases. Chicago University in 2007 said, you know what? Let's do a double-blind study where we do the upper cervical correction, so at the top of the spine, this gentle correction, get that keystone of that foundation, that atlas bone, corrected specifically, and let's compare it to drug therapy. I'm not putting mainstream medicine down right now. There is a time and a place for it, but is that really fixing the cause? They found that when that atlas bone was corrected, it was not just better than one, but 2 drug therapy combination to lower down blood pressure.
Wow.
Because we're fixing the issue. Of course, there's many different factors. Diet is huge. Sugars, carbohydrates, or even if you drink a lot of caffeine, that can raise blood pressure temporarily. If you go outside and exercise, it's very good to do. That can help out as well. So, but all these different factors, especially sleep, you gotta get the right amount of sleep. Don't sleep on your stomach. If you do that, you gotta get off the stomach sleeping, because you're twisting your neck all night long, and it's causing so much tension in that back and spine. And that's why when people wake up in the morning, my neck's really sore. It's because your head, if you're a stomach sleeper, was twisted all night long.
Just hyperextended for a long period of time. That makes sense.
Yeah, I mean, if you want to experiment, stand in front of a wall with your stomach facing it and turn your head to the side. After about 5 minutes, it might hurt, but you're tired though at the end of the day, so your body doesn't care. It's the pressure that we like. When our stomach is flat, we get that compression, and it's very, very comfortable. But try to get to that side, or back sleeping is fine too, and get something to kind of be close to your stomach, something like a heavy pillow. Tempur-Pedic pillow is great, but we sleep. A third of our life is done sleeping. So if you're not sleeping well, you're setting yourself up to have a bad day and to really not be able to function to your full potential too.
It's true. Back to that foundation, right?
Yeah, I mean, the foundation's important. I mean, if you these people moving down to the Lutz area, if you look at a house, the house has to get inspected, right? So they look at the foundation of the house, and they'll probably make note that, oh, the floorboards are loose, the windows, they're not closing properly, the roof shingles are falling off, the drywall keeps cracking again, over and over again. So what do? Oh, well, clearly, ma'am, you have a foundation problem. So it doesn't make sense to just patch the drywall. It's cheap though.
Sure.
We can do that, and
Band-Aid on it.
Exactly. A temporary fix, instant relief, but we're back to where we are because we're not fixing the primary condition. We're not fixing the cause of that drywall cracking.
Sure.
And there's a lot of chiropractors in the Tampa Bay area, and they're great at what they do. But pain management, okay? If they want to get some natural pain relief, that's great. That's why they're there. But if you want to get true correction, I always tell people this: life is great when your head's on straight. So if we can get the brain-body connection, it's really easy. If you take your hand, this is the brain up top, this is the rest of the body, you pinch it at the wrist, it's hard to open and close. This is your brain trying to send signals down through your body. Or if you take a slinky or a chain link, you stretch it out, you twist the top, it's going to twist the bottom, right?
Like a chain link.
Exactly. So if we do the traditional method, which is great, helps out a lot of people. We get a lot of cracks, get a lot of pops, man. We had a great day. So we do the low back twisting and cracking, but if the top is twisted, even though there was no pain, but we shouldn't be focusing on spots that have symptoms. If there's no pain, as soon as you go against gravity, guess what happens? Your head was not on perfectly straight. Slowly, we go back to where we were. That compensation, and the low back pain comes back.
That makes sense.
So we got to get the head on perfectly straight. Now, how do we determine that? Okay, first is a consultation. A consultation is complimentary. There's no charge, because I need to sit down with them and figure out if I can help them or not. Because there's been some times that they're too far along, or they need to go someplace else before we even get started.
I can appreciate that.
Exactly. So we explain the process, see if they're right for the procedure, and see if we're a good fit. If we are, and if I see fit, we will get the x-rays at that spine. If there is a lot of pain in the low back, we will look at that area too, but we do a full body examination, figure out what's going on, come back, we go over everything, we do a test correction, see how your body reacts to it, and then we do a post x-ray. So some chiropractors, they do x-ray, some of them they wait until there's trauma, or if there's no success, but I need
a diagnostic,
Yeah, as a diagnostic tool, but I'm using as a structural tool. I'm looking at that blueprint of your body and figuring out how that foundation is shifted. It's great that you feel better after the adjustment's done, but that's subjective though. We need to be objective. We don't use guesswork. We need to confirm. So I do a post x-ray afterwards. So I can look at that upper spine, seeing how it's back to normal. Your head is nice and straight. Everyone's different. They have their own, people have their own thumbprint. I've never found someone with the same exact bone anatomy at that upper spine.
On the after, interesting.
Yeah, before or after too, the bones, they're totally different shapes, different angles. But yeah, I'm basically using some math involved. You use a little bit of math to figure out the specific angle to take at that bone. And it's not just correcting this, I'm using that keystone of the foundation as a lever to get the body back in alignment.
Sure, that's fascinating. Another thing that comes up a lot, and I didn't realize that this was something that you would be able to treat or address. I have a lot of clients that come to me with food sensitivities, different issues with that, and that can be really expensive to go to an allergist and go through the whole litany of testing in office. So, I'm always out there looking for ways for my clients to make the most of that healthcare spending. How are you helping your patients like that?
So it's a great question. I would love to say that getting that upper spine corrected can fix everything, but that's just not how it works, because again, back to that full spectrum, sleeping, diet, exercise, foundation's important, but internally, so I'm actually going to start doing DNA nutrition testing. So we'll be doing blood sampling. Next door is Quest Diagnostics, so it'll be very quick. And we'll do saliva testing too to figure out specifically at their genetic, makeup, what is going on with this person. Because we can do all these tests, all these procedures, spend all this money when it could have been done from the start. That, oh, hey, your body, the way that you're made, you probably got it from your grandma, or maybe that's a factor too. But for you and your blueprint, this is what's wrong. You have this allergy, or your thyroid is like this. So a combination of the foundational correction, correcting that foundation, and then mixing in their specific nutrition testing to figure out what's going on. That's how we're really going to just get everyone healthier, so we can protect ourselves, which is really important nowadays, to get our bodies protected from getting sick.
Yeah, we're all everybody's talking about we want to build up our immunity, and we're always looking for tips and different things to help with that. So what other tips would you have for immunity?
I mean, a lot of people, they love to wear the mask, and that's their choice, of course, and sometimes you have to wear it, but one of the biggest things, and one of the cheapest things out there, is a vitamin D supplement.
Yeah.
They're showing that almost 75% of all the hospitalizations of COVID-19, they're finding these people have decreased levels of vitamin D, very, very low levels. And where do we get vitamin D from? Sunlight, okay? So if we're not in the sun because we've been inside since March, or our jobs are keeping us, because most of us don't work outside, we have office jobs, you need to get at least 20 to 30 minutes of direct sunlight without sunblock between the hours of 10 and 4.
Okay.
That's when the UV index is at its highest. So most of us, we go to the beach, and as soon as we get to the beach, we put our stuff down. What happens?
Right.
We spray on the sunblock, which is fine if you want to prevent a sunburn, but wait 20, 30 minutes. Or take a vitamin D supplement. And how do you really get that checked? Talk to your doctor, of course. Get a blood sample done. The blood test is really easy, and that's going to show exactly what's going on with the vitamin D. We are also going to be doing vitamin D testing in our office too.
A lot of people are deficient. Yeah.
A lot of Americans are, and it is a very low cost supplement. It's free too with the sun, but it works with your body's immune system. It helps with the lung tissue so we can breathe better. Turns on certain genes to fight off certain types of cancers too. They're finding a lot of stuff out with vitamin D, even though it's actually a pro-hormone. It's a steroid. It's not even a vitamin.
Oh, is that right?
It's the number one deficient vitamin. Number one deficient mineral is magnesium, which is dark leafy greens, which not a lot of us eat. But the vitamin D is so crucial. We get joint pain, we get depression, we get all these types of bone issues, all these types of problems because the vitamin D is decreased. So, talk to your doctor first, get the blood sample done, figure out what's going on. But if someone had a choice of vitamin C or vitamin D, take the vitamin D. Vitamin C is so prevalent in foods. You know what? This is a bonus question. What is the number one food source of vitamin C?
Let's see. It's probably not what we would instinctively think, right? Broccoli?
Broccoli, that's very, very close. If anyone knows, you can comment too. But the number one is sauerkraut.
Sauerkraut.
Homemade, the smelly homemade sauerkraut.
Really?
It's a fermentation process.
Okay.
So fermented foods are excellent. Drink some apple cider vinegar too. I drink that first thing in the morning. I wake up, have a swig, chase it with cold water, good to go. The apple cider vinegar is tremendous for your health. Probably next to vitamin D, dollar for dollar, the cheapest thing, the best thing for your health. It stabilizes the pH in the body. It helps with if you have any kind of GERD, if you have the acid reflux. That's not because of too much acid. Usually it's the food that we eat and stress, but the valve, the sphincter in the stomach to your esophagus, to your throat, it's not closing properly. So what happens? You're tasting, you're getting the regurgitation of the stomach digesting. So a lot of doctors, they're great at what they do, but they give antacids. You're destroying the acid in the stomach. Of course, what do we need the acid for?
Right.
To digest, absorb protein. Also, it's the body's immune system. That acid kills off bacteria and viruses. So when you drink the vinegar, it's cider fermented twice. So you get one, the first time is hard cider, the second time you get the apple cider vinegar. It does not taste good. It tastes like gym socks and Apple Jacks.
Yeah,
it's pretty gross.
It's pretty horrible.
You don't get used to it, but if you just take it real fast or dilute it as much you can, put some ice in there too.
Yeah, cool, right?
Cool. Yeah, it's much better, but smelly feet, it's good cleaner. There's many different things for it, but the biggest thing is getting your body to homeostasis, getting it back to normal, back to the regular pH. So stabilizing with that, vitamin D, your foundation getting checked, DNA nutrition testing, everything needs to go back to health and getting healthier. It's not the lack of symptoms that we're healthy. Because if someone has a heart attack, do they feel the plaque starting to build up in their blood vessels? Do they feel... No, the first symptom that they get is having the heart attack. So if you can be proactive and protect your body with natural armor, which is the body's immune system, I mean, the nerves regulate the body's immune system, so what protects the nerves? The spine, right? So if we can get to normal, we're not going to obstruct nerves. We're going to have a better functioning nerve system, and our body can heal itself, do better at functioning.
Fight off everything, right?
Exactly.
That's awesome.
It's an automatic operating system, okay?
That is awesome.
When you're sleeping, do you think about your heart beating or even breathing? No, it's done automatically. And if we can get that automatic operating system functioning as close as possible to 100%, a lot of my long-term patients that they get the education from coming into the office. I do a weekly educational seminar where I teach them, because they have to understand not just what we're doing in the office and what I'm doing to their body, but it's really what I'm doing for their body and what their body can do outside of the office. So the more that they know about that, the better they can take care of themselves.
Exactly. And that's back to that empowerment, that educating to really, just like you said, have our bodies working at that optimal level.
And when we're functioning at that optimal level, the long-term patients that, do I have to keep going to the chiropractor? Well, it's your choice. You have to keep going back to the gym? I mean, no, but the benefits are great. The long-term patients, they don't get sick as much.
Sure.
They don't have as many aches and pains. If they do, they come in, it's a screening process almost, and like, okay, let's get the correction, let's get you back to normal, and their lives are much better. So that's what I'm trying to install here, and why I want to get this practice up and going, is that there's a lot of people, and it's showing in this country, that we are not healthy, we are inflamed. We think by taking a cheap multivitamin that we go to the bathroom, it comes right out of us, that we're fine. When really, the number one thing is to get the right amount of food. I'm not saying substitute food. The only thing that you can really substitute for besides the sunlight is that vitamin D supplement. Okay, the vitamin D supplement, a probiotic, but all your greens should not be in a pill or powder. Should be the actual food. Because what's the benefit? Fiber. We can get the fiber from the broccoli that you mentioned, the dark leafy greens, and the dark leafy greens. I mean, people drink milk because of vitamin D or calcium, when really you need 10 cups a day of milk to get the recommended vitamin D.
Right.
And what's better, a way better form of calcium is dark leafy greens.
Yeah.
Kale.
Do we really need to be drinking milk all day? I don't think so. We're learning.
Yeah.
We're getting smarter too.
That is fascinating, Doctor. I so appreciate that. Now tell the audience how they can get a hold of you. I understand you have a complimentary consultation.
Yeah, of course. So the consultation is always complimentary, so you can just figure out how we, are, if you're a good fit, for this procedure or not. You can call the office, 813-578-5889.
Say that one more time, a little slower.
813-578-5889. You can also just message me on Facebook. If you find me on Facebook, feel free to message me. You can go to Foundation Chiropractic and like the page. You can send me a message too. Would love to get to know you guys and help my community, because it's not just, let's manage this pain, let's get you out of pain. Let's not even think about pain. Let's think about, what, I slept better tonight, or I digested better. I don't have that digestive problem. I don't have, chronic constipation anymore, or no more headaches, but we're able to function the way that we're built, the way that we're made, if the foundation is close as possible and checked periodically to normal.
That is well said. I love the proactive approach. We're all looking for ways that we can take control of our health and really, and I'll say it again, really be empowered to make the best decisions with those healthcare spending dollars. And I just want to encourage you guys, reach out to Dr. Brett, see what he has to offer at his practice, Foundation Chiropractic. And as always, you can reach me at Rochelle Insurance Girl here on Facebook. And this is Rochelle Insurance Girl with my guest, Brett Berner. Thank you again.
Of course, thank you for having me.
We're doing it all just for the health of it. Thank you.